This 41-year-old female patient was referred to me for endodontic treatment of tooth number 14. As you can see, tooth has a temporary crown on it, so tooth was worked on and prepped for a crown, and afterwards she had developed all the signs and symptoms of irreversible pulpitis with acute apical periodontitis. So she was referred to us for endodontic treatment, dental phobic patient, so we needed to sedate her, do this root canal for her. So as you can see, as I said, there is a temporary crown on the tooth. Tooth was tender to percussion and palpation. And according to the patient, nothing cold, nothing hot could touch the tooth. Otherwise, she'd be in excruciating pain. She had also pain to biting down and chewing on the tooth. So we went ahead and IV sedated her and did this root canal for her. So let's go ahead and watch together. It'll be my first time watching this video with you guys. I did this root canal a few months ago, so it'll be my first time watching it. So let's go ahead and watch it together and talk about it, steps, and everything else. All right, POV, let's go. All right, so rubber down, of course. All right, rubber dam is on. I'm not gonna remove the temporary crown. I'm just gonna go ahead and go through it. Sometimes when you remove the temporary crown, then there's not much height left to the tooth, so putting a clamp on the tooth will be very challenging. So right now, this temporary crown is giving me enough height to stabilize my rubber dam clamp. My assistant is wiping down the tooth and everything else around the tooth with 70% isopropyl alcohol. And let's go ahead and make our endo access through this temporary crown inside of this tooth number 14. All right, so that's the tooth. All right, let's go ahead and get started. And again, I don't use water, but I strongly recommend that you use water. I know how I use my diamond burr and not heat up the tooth. So, but I've been doing this for many, many years. So please make sure that you use water. If you're a beginner, you don't know what you're doing, really. So make sure you use water. I'm just brushing away the dentin. I'm not allowing the diamond burr to sit on the tooth for an extended period of time. As you can see, my assistant to the right is blowing air on the mirror and inside of the tooth, and my assistant to the left is suctioning. This is 6-handed endodontics. Brushing away the dentin. Brushing away the dentin. Slowly, we take our time. again, I just fell inside of the pulp chamber right there, as you can see. And I'm just unroofing the pulp chamber. And you can see how hyperemic this pulp tissue is. Brushing away the dentin, exposing the orifices of the canals, just brushing away. You can see the hyperemic nature of the pulp tissue here, and we expected that, of course. That happens when the pulp is in the state of irreversible pulpitis. All right, so now I switched to a thinner end cutting diamond burr. And I'm going to expose the mesiobuccal 1, mesiobuccal 2, and distal buccal canal. So I'm just troughing along the mesial wall to expose the MB1 and the MB2. And you can see again the hyperemic nature of the pulp tissue here. Extremely hyperemic. All right. The best way to stop the bleeding of this pulp tissue so we can see what we're doing is by removing it. So I'm just going to go ahead and do a quick 1/2 pulpectomy. I'm not going to go all the way to my estimated working length right now. I'm just going to use my number 20 flare file that's attached to my reciprocating handpiece that I'm running at 1000 RPM with the torque off. And I'm just going to put it inside of the orifices of these canals and brush the hyperemic pulp tissue out. As you can see, that's what I'm doing, and my assistant will suction it. This is a quick way to get rid of all this hyperemic pulp tissue so we can see what the heck we're doing. We can see where everything is. All right, so that's what I'm doing right now, as you can see. Just a quick 1/2 pulpectomy to get rid of most of the hyperemic pulp tissue. This is a flare file. It has a 5% taper. This is a stainless steel file, but has a 5% taper. All right. I'm inside of the MB1 canal right now, and I'm just trying to feel to see if I can get it inside of the MB2 canal. And the MB2 canal is a little bit tight. I found it already, so I'm not going to bother with it right now. So as you can see, the bleeding kind of stopped. All right. So I'm trying to feel the MB2 right now, and I'm using an 08C file that's attached to my reciprocating handpiece that I'm running at 1000 RPM with the torque off. I'm not using any hypo or any other irrigants. I'm using the juices of the pulp tissue. That's what I'm using right now as lubricant. The pulp tissue juice. Have you heard that saying? They say fight fire with fire. That's basically what I'm doing. I'm using the pulp tissue juices for lubrication right now. 08C file, just trying to get a feel for where everything is and scout the canals with this 08C file that's attached to my reciprocating handpiece that I'm running at 1000 RPM with the torque off. Now, count how many times I say that 1000 RPM with the torque off and read the comments. There's always one or two people who say, Doc, what is this handpiece? It's a reciprocating handpiece. I say it a million times. And what RPM and torque settings do you run it at? I think they must have watched this video with no sound, a muted video. They had the sound muted. All right, this is 2% sodium hypochlorite, and I'm using my Ultramin Pro ultrasonic unit manufactured by 8 Teeth, and I'm using a scalar tip here. And I'm trying to get rid of all the remnants of the pulp tissue, all the blood and everything else that had filled the pulp chamber, getting rid of all of that. And as you can see, we did that. All right, now I'm switching to 6% sodium hypochlorite in my syringe, side vented irrigation needle. You can see I'm still getting blood from bleeding from the palatal canal. All right, I'm going to be working on the MB2, and lo and behold, there it is. 08C file in the MB2 canal. There you go. And it's going to my estimated working length. Very nice. And as you can see, when I use this reciprocating handpiece that I'm running at 1000 RPM with the torque off, when I attach a file to it like that, I'm not only using the file for instrumentation and shaping of the canal, I'm also sonically activating the 6% hypo. Pay attention to how I'm using these files. I'll use them in a brushing motion, up and down brushing motion, as you can see. So that way I'm not only instrumenting and shaping the canals, I'm also activating sonically the 6% hypo. Again, back in with 6% hypo. My assistant is drawing the pulp chamber, and take a look here. You can see the MB1, MB2 right there, distal buccal and palatal right there. How long did that take us? Not much time at all. All right, let's go ahead and take our measurements. I'm using the FinePEX apex locator by 8 Teeth here, and I'm going to be getting all our measurements using this apex locator. It's a great apex locator for the money. 8 Teeth makes very good products. I love my Ultramin Pro ultrasonic device. I love the FinePEX apex locator. Recently, I got the Surfy one, the sonic activator that I love. I didn't have it when I was doing this root canal. I just recently got that. This root canal is from March of this year. All right, so I'm measuring the working lengths here. All right, I mark them to my reference point, then I'll give them to my assistant to my right. My assistant reads them, and from then on, my assistant to the right is responsible for giving me every file that I need based on the working length measurements. So I trust my assistant that much. Train your assistants and train them well. The more your assistants know, the faster, quicker you are, and better off you are. All right? So we got our working lengths. Let's go ahead and irrigate again with 6% hypo, and let's start cutting some dentin. All right, let's go in. Let me see what file that is. It's probably a 10 file, 10C file. Let me look at the... No, actually, it looks like a 15. Looks like a 15C file. So I think the canals were wide enough that I skipped a 10. All right, I'm inside of the MB2 canal right now with a 15C file. Excellent. Up and down, up and down, up and down, brushing motion, up and down, brushing motion. Not only instrument and shape, but also activate the hypo, 6% hypo sonically with this device. Is a reciprocating handpiece, reciprocating M4 safety handpiece. You can Google it. If you purchase one of these, please make sure you practice on 10s, maybe 30, 40, 50 extracted teeth before you use it on a patient. It looks like the working lengths turn out to be 20. I'm using 21 millimeter files. Again, I'm watching this video with you guys. I did this root canal months ago, so I'm watching it for the first time with you guys. Again, irrigate with 6% hypo. Let me see what instrument this is. I believe this is a flare file. Yes, it is a flare file. Number 20 flare file that I'm running at 1000 RPM with the torque off in this reciprocating handpiece. I'm not only instrumenting and shaping the canals with all of these files, but I'm also activating the 6% hyposonically. I don't push this file. I don't push it. I don't apply a whole lot of force to it. I just let it go where it wants to go. I use it in a brushing motion, brushing away from the center of the tooth in this case, towards the proper line angles. And take a look. You see how I'm using it. Up and down, brushing motion away from the center of the tooth, tooth number 14, upper left first molar, and towards the line angles of the tooth. And you can see the MB1, MB2 here. I'm irrigating the canals again with 6% hypo. We got the distal buccal right here. And then, of course, the palatal to the right. And that's the palatal right there. 6% hypo. I'm not allowing the irrigation needle to bind to the canal walls, and I'm not applying a whole lot of force to the plunger of the syringe. All right, again, back in with my number 15C file. Up and down, brushing motion. As you can see, I want to create a very good taper and glide path for these canals. I'm in the MB2 canal right now. Up and down, activate that 6% hyposonically at the same time as I'm instrumenting and shaping the canals. There you go. Very good. Let's go to distal buccal. Excellent. Very good. And palatal. Very good. Up and down, up and down, up and down. Brushing motion, up and down, up and down. Activate that 6% hypo. And let's go back in and irrigate again with 6% hypo. Very good. Look at that. MB1, MB2, distal buccal, palatal, conservative endoaxis, straight line to the canal orifices, no compromises. All right, I'm using the easy shaper files here. These are the files. Easy shaper files. All right, and that was the first file, easy one, easy shaper files. Okay, you can purchase them from flexivodental.com if you like. They're great files. I've been using them for months and I have not broken a single one of them. Up and down, brushing motion to my reference point for each canal. As soon as I'm done with using the file, I have my assistant to my right clean the flutes. I'm in the palatal canal right now. Very good, to my reference point. Excellent. But I'm sure you were paying attention. Before I put a NiTi file in these canals, I made sure that I had a very nice and predictable glide path to my working lengths, okay? I didn't go straight to a NiTi file. There was some preparation involved. Straight line axis, glide path that I achieved with my reciprocating handpiece and stainless steel K files and C files. You saw that, C files and flare file, okay? So next file in the series of the easy shaper files, again, up and down, and you saw how much cutting it did. The flutes were filled with dentinal debris. That's what you want to see. Very good. Palatal done. And I'm going into the MB2 canal right now. Again, I'm not forcing the file. I'm just letting it glide where it wants to go. And again, you saw the cutting. You saw the dentinal debris. All right, let's go in and instrument and shape the distal buccal right now. Very good. Up and down, up and down. I'm not forcing it. And then my assistant to the right cleans the flutes with a 2x2 soaked with 70% isopropyl alcohol right now. Again, 6% hypo, copious irrigation. Perfect. Very good. All right, we are done. Just like that. I'm gonna be making my custom master gutta percha cones. Number 20, I'm using a number 24% here. And you saw when I placed the gutta percha cone in the canal, I did an up and down motion. Again, kind of activating the 6% hypo. I use a number 24% to make my own master gutta percha cone. I place the file, see, up and down, activate. I'm in the MB2 right now. I let it go as far as it wants to go, measure it to my reference point. If it's more than my working length, then I cut it. I cut the tip accordingly to my working length. And that's how I make my master gutta percha cones, custom master gutta percha cones myself. So that way I don't have to have every single gutta percha cone number gauge. I can make my own. Okay, so let's go to the next video. All right. Palatal now. Again, up and down, slowly up and down, up and down. And let's see if we can seat it to working length. It's not seating to working length. You notice that. The gutta percha really didn't want to go to working length. All right, so when that's the case, I don't waste time. I just ask my assistant to give me another file. This time I'm using the Super Flexi Gold, and I'm using, looks like the yellow Super Flexi Gold. The yellow one is a 2004. I'm going to open up that palatal canal a little bit more. Perhaps there was a little bit of a pulp tissue remnant or something like that blocking me. So I just opened up the palatal canal a little bit more. That's it. Now let's go ahead and see if we can seat a number 20 file to working length. Real world endodontics. All right, so I asked my assistant, okay, maybe 20 is a little too flimsy. Let me have a 25, 4%. And 25, 4% worked. Sometimes the 20, the tip is really flimsy. So as soon as it touches any roughness, perhaps, any catch on the wall of the canal, it kind of bends. And once it bends, it's over. So 25, as you saw, 25 worked perfectly. All right. So very good. What I used just now was 70% isopropyl alcohol as my final irrigant. Now I'm using my microsuction to remove most of the 70% isopropyl alcohol, so then I can use my sterile paper points to further dry the canals and go ahead and obturate. All right, so take a look here. It seems like MB1 and MB2 join, because once I put the microsuction in the MB1 canal, the isopropyl alcohol in the MB2 disappeared as well. As you can see, there's slight bleeding, but that's normal. Nothing to be worried about. Look at that beautiful MB1, MB2 right there. All right, this tobacco you can see. All right, let's go ahead and place our sterile paper points. And this is another way to see if they join. And as you can see, they do join. Look, they're uneven. So I placed the paper point in the MB1 and then one in the MB2, and they don't want to go. And you saw the bleeding. And that's normal. There's nothing to be worried about. It's not a big deal. Bleeding is not a big deal. Especially when you recapitulate. Sometimes that happens. It's okay. Remember, we're surgeons. Some people freak out as soon as they see a little bit of blood in the canal. Remember, you're doctor of dental surgery. A little blood should not worry you at all. We know how to stop the bleeding, don't we? We're doctors. The best way to stop the bleeding is putting pressure. And these paper points are doing that right now. Just applying pressure. Let's go ahead and obturate the other canals while we got the paper points in the MB1 and MB2 canals. So I'm obturating the distal buccal right now. AH plus sealer. Dip the master gutta percha cone in AH plus sealer and placed it in the distal buccal canal to working length. Number 25 that I custom made for the palatal canal, dipped in AH plus sealer. So what I said was that it's too crowded. Let's just go ahead and do the distal buccal and get rid of that. I believe that's where I'm going. Yes. See, I'm watching this video and I'm thinking for the first time with you guys, and I'm thinking to myself, what would I do if I was this clinician? It seems like there's, there are too many things right now in the tooth. You got 2 paper points, and you got gutta percha in the distal buccal, and now you want to obturate the palatal as well. It's just too many things. So at least you can do is get rid of the obturated distal buccal before you obturate the palatal. So that's what I did. So used System B heating unit and removed the coronal part of the master gutta percha cone and thermoplasticized the rest of the gutta percha in the canal, and then used a number 2 Buchanan plugger. All right, so now this is a trick. That palatal was giving me a hard time. All right, the palatal was giving me a hard time. So I asked my assistant to give me the next file in the Superflexi Gold series and dip that file in sealer, AH plus sealer. And I used that file, and I placed that file, used it, and I put it to working length with the sealer, AH plus sealer. This is a gold nugget that I'm giving you right now. A gold nugget. You saw it here first. And now I placed my master gutta-percha cone in the palatal canal, and I'm measuring it again just to make sure that it's going to working length. Again, dipped it. Now that I know that it's going to working length, dipped it again in H+ sealer and placing it in the palatal canal. System B, to remove the coronal part, coronal to mid part of the master gutta-percha cone, and thermoplasticize the apical portion of it. My assistant just removed the what I had cut, and now I'm using a number 2 Buchanan plugger, and I'm condensing this thermoplasticized gutta-percha in the palatal canal. As you can see, there is still a paper point in the MB1 canal. The paper point in the MB2 came out. And I left that paper point in there because there was some bleeding from the MB root. And again, that happens. If you do endo, you encounter stuff like that. If I show you a perfect root canal from start to finish with no complications, what are you going to learn? This is real world endodontics. Endodontics in the trenches. Remember World War I? War of the trenches? This is what we have right now. Every day. Okay? This is war in the trenches. You stick your head out, you get shot at. Just condensing the gutta-percha, thermoplasticized gutta-percha in the palatal canal. And I'm giving that MB root plenty of time to be able to manage the bleeding. All right, so I'm using my Obtura gun, Obtura 3 Max gun, to obturate the rest of the canal now. This to buckle right now, okay? And then I'm gonna go to palatal. And I'm gonna obturate the palatal canal. The remainder of the palatal canal. Very good. Let's go ahead and condense. Number 2 Buchanan plugger. These are great pluggers. One end is stainless steel and the other end is nitai. So great file, great condensers, pluggers, condensers. I'm working on the palatal, as you can see. Taking advantage of these POV videos, I think I've posted maybe 15 so far, something like that. I've posted many, and I'm near the end because I no longer have this microscope. It was just a microscope that they brought for me to test out, to try, and kind of market for them. It's a great microscope. Don't get me wrong. Beautiful microscope, as you can see. Great microscope. But I have 2 global microscopes. So I don't need a third one. And a third one that is the price of a luxury car. But if you're in the beginning of your career, and you're looking for a microscope with an integrated 4K camera like this one, definitely give these guys a chance. All right, so I'm done obturating the distal buccal and palatal canals, and let's go ahead and remove this paper point and see if we were able to stop the bleeding from the MB root. Sterile paper point again, goes to working length. Let's pull it out. And lo and behold, no more bleeding. Bleeding stopped. No more bleeding. So did you see what we did here? Did you pay attention? We just took our time. All right, but I can't leave blood behind in the canals, right? So 6% hypo. We got to clean that blood from MB1 and MB2 canals. But be careful. Don't go too deep. With the irrigation needle, you can make the canals bleed again. So, and then you have to start all over again. So be very careful when irrigating with 6% hypo. We already stopped the bleeding. We don't want to make the canals bleed again. So microsuction goes in, no more bleeding. I'm not going to keep the microsuction in there and cause bleeding again. Let's go ahead and dry the canals again with sterile paper points. Very good. See, no more bleeding. Came out nice and clean. And again, perfect. There you go. No more bleeding. See? Right there. That's it. Remember, you are doctor of dental surgery. You're a surgeon. A little bit of blood. Don't panic. All right. So gutta percha dipped in H plus sealer. Master gutta percha cone goes into MB1. Perfect. Let's go ahead and place our master gutta percha cone in the MB2. Dipped in H plus sealer. There you go. Goes in. And remember, they join, so. System B, to remove the coronal part of the gutta percha and thermoplasticize the rest. Excellent, very good. And Buchanan plugger, number 2, to condense the thermoplasticized gutta percha. I asked my assistant to give me a number 1 plugger, Buchanan plugger. Just to make sure I get a good condensation. All right, excellent, very good. Let's go ahead and use our Obtura gun, Obtura 3 Max gun, and let's go ahead and do MB2. Number 2 Buchanan plugger. All right, very good. Remove the extra gutta percha, just like that. Very good. My OCD has kicked in full force. Someone needs to stop me. All right, very good. We are done. I'm gonna clean the pulp chamber with 70% isopropyl alcohol, and sterile sponge goes in, cavet goes in, and we are done. We are done with this case. All right, here we go. I fast forwarded a little bit, a few seconds, so you missed the cleaning of the pulp chamber with 70% isopropyl alcohol. So sterile sponge went in, cavet, and as you can see, the temporary is intact, temporary crown. All right, we're done. Rubber dam is gonna come off, and let's go ahead and look at the post-op radiographs, see how we did. So remember, this is what we started with. You can see that was a pulp stone in the pulp chamber right there. And let's go ahead and look at the post-op radiographs. Here it is. That's one angulation. Look at that conservative endoaxis, straight line into the canals, through the temporary crown. MB root, palatal root, distal buccal root, all two perfect working lengths. In this angulation, you can see the MB1 and the MB2 that join. Kind of mid-root here. Distal buccal, of course, and palatal. All right, so as you can see, everything went great. Another POV done. I hope that you have subscribed. I hope that you watch these videos multiple times. When I was at your level, if I had a case like this from start to finish, I would probably be watching it 100 times. Okay, so now you have plenty of these POV clinical videos. I don't know how many. I think it's 15 of them, maybe more. And a couple of more are coming too, but we're getting near the end of these POV videos because, as I said, I don't have that microscope anymore. But I've given you everything, I've given you molars, anteriors, MTA placement, POV videos. I mean, every possible treatment, retreatments. I've given you retreatments, molars, anterior teeth, what have you. So I think with these POVs, I've pretty much covered every part, every treatment in endodontics. I have actually posted quite a few apical cases as well. They're just, you need to go back a couple of years to find those videos also. But those videos are POV videos of a couple of apicals that I've done. You have those as well. But anyways, please make sure, as I was saying, you subscribe. Make sure you press and click on that like button. Make sure you make a comment and tell your friends. This is free. You know, I was here today at 5:30 in the morning to make this video for you guys. And every time I have to make a video, you know, it's not easy because now I have to relive the work that I've done and then be able to have a voiceover over the video, keep my hand steady for an hour or sometimes more, holding my iPhone looking through my iPhone through a bright screen. So anyways, I'm putting so much time and effort into bringing these videos to you guys for no financial gains. I make zero money doing this for you guys. Zero. I have zero financial gains in this other than just trying to spread the knowledge that I've gained in the past 24 years for free. Just spread it throughout the world because my videos are being viewed by thousands of people throughout the world. I have people that are watching my videos from a village in the middle of nowhere, Afghanistan, to Nepal. I mean, you name it. I'm so surprised sometimes I get a message from someone in some remote village in China who's watched my video and has questions. I mean, this is great. It's very heartwarming, and that's why I'm doing it. Again, there's zero financial incentive in me putting so much time, so much of my time, so much of my energy into these videos and bringing these videos to you guys. So the least you can do is like it, press that like button, subscribe, share it with your friends, tell your friends about it. It's free. So just tell your friends, this guy is crazy. If it was anybody else, they would be monetizing all of this. But this guy is just doing it for free. So go ahead and watch it and learn something. Anyways, I hope you enjoyed this video and see you guys in the next video.